Alrighty class, today I'm going to be showing you the anatomical position first. She is standing with her thumbs facing outward, feet facing forward, and in the erect position while also looking forward. She is demonstrating the anatomical position. Next we have your anterior and posterior. Currently you're looking at the anterior side of her body, and now you're looking at the posterior side of her body. So when she turns around, her lungs, or her ribs, are anterior to her spine, and her occipital bone is posterior to her frontal bone. Next we have superior and inferior. Superior is towards the head, inferior is away from the head, and her lungs are superior to her liver, because her liver is below her lungs, and then her small intestine is inferior to her stomach because it's away from the head. Next we have proximal and distal. Her scapula is proximal to her humerus, and her wrist is distal to her elbow. And what I forgot to mention in the beginning was that proximal is towards the trunk of the body and distal is away from the trunk of the body. Next we have medial and lateral. And medial, her trachea is directly on the midline, and her clavicle is medial, her trachea is medial to her clavicle, and her wrist is distal to her elbow. Next we have superficial and deep. Superficial is towards the surface of the body, so you're currently looking at the surface of the body, and this is her epidermis. Below that is her dermis, so her epidermis is superficial to the dermis, while the deep is away from the surface of the body, and her hypodermis is deep to her dermis. Next we have sagittal, transverse, and frontal planes. Her sagittal plane divides her in half right down her midline. Her transverse plane cuts her in half in equal parts, top and bottom, and her frontal plane divides her in half in her anterior and posterior portions. Thank you.